everyone. Right, we are back. So I'm going to just go over the beginning again. Welcome everyone to our COVID webinar. This is very much about long COVID. Apologies for any of the internet issues, and hopefully now everyone can hear. I'm going to just take you through some of the stages of infection, inflammation, before we look at the issues of long COVID and post-COVID and key nutritional strategies. Just a reminder to those that are listening that we have another COVID webinar that we've already recorded, and that was really taking you through some of the basics of the immune system, how the immune system works with viruses and bacteria in particular. And so if you're new to this, I would say go on that webinar first and then listen to this webinar. I think that might help so that you can understand it. So I'm hoping that you can hear me. So the first thing we want to do is, when we're looking at our immune response, when it comes to SARS, we want an efficient antiviral immune response. Now that's our Th1 response. So those are our T cells that will develop into Th1, and they are incredibly efficient at hitting our bacteria, viruses, so pathogens that come into our space. So we need that to be efficient if we are trying to protect ourselves from viruses, particularly SARS. Now, the other good thing is that a good Th1 response will also inhibit Th17, and Th17 is linked to autoimmunity. So if you suffer with an autoimmune condition, it is likely that you have a number of T cells that are Th17. Well, when we have good viral surveillance, we actually inhibit Th17. So that's a great thing if we're struggling with something that's ongoing, that's autoimmune. We also do want some good anti-inflammatory response, because the definition, when we try and fight a virus or bacteria, there will be inflammation. That is part of the immune resolution killing phase. So we will want our body to be able to lower inflammation. And that brings us to the question of, what is your baseline inflammation? Because if you are already in a very high state of inflammation, then it's going to be more difficult to counteract the extra inflammatory response happening when we're trying to deal with the virus. And so we need to be looking at our lifestyle and our diet first to say, right, I need to remove any inflammatory foods, stress in my life, poor sleep, blood sugar imbalances, food that I'm intolerant to. And I'm just going to quickly recap what happens when we do get an infection. So A is what we want in this graph. We have an infection. We then get an inflammatory response. The neutrophils are coming in. They're asking the macrophages to come in and grab and gobble up the viruses, the debris, and so on, and clear it. We then have resolution. We have our T regulatory cells quietening everything down, lowering inflammation. That's in the pink. So that's a good resolution. We've cleared the virus, the inflammation's gone down, we're back into resolution, and we probably say, do you remember that time I had a virus? Fine now. What we don't want is anything in B or C. In B, what we've got is an exaggerated inflammatory response, and we don't get any resolution at all. So we might clear the virus, but we're getting extra tissue damage that's ongoing, and that will obviously increase any autoimmune or any inflammatory condition that we still have. So you're going to have that sustained inflammation. Or we can have a situation where almost we've got too much tolerance to that virus, and we don't have an effective viral killing strategy. So the virus lingers. The virus causes damage to our tissue, and makes us more prone to getting more infections because we don't have an efficient killing Th1 response. So we don't have resolution, we have inflammation, we have the virus lingering. That is not what we want at all. And so there are 4 key phases of what I call a COVID infection. And you may be at one or more of these stages. The prevention is simple. We just want to make sure we have an efficient immune system and low levels of baseline inflammation so that if we get the infection or any other infection, we're going to be able to deal with it quickly and efficiently. We may be in the case where we have the infection, in which case what we need to do is really focus on things like NK killer cells, Th1 responses, so that we are enhancing our activity against that infection. If we've got escalating inflammation, so we feel that we may have had the virus, but we've got this lingering inflammatory response, then our focus will be on more anti-inflammatory measures. And that ties in with recovery as well. And these two really tie in with long COVID. When we're in recovery, what we want to do is resolve any inflammation and also, regarding SARS, inhibit fibrosis or any other tissue damage and re-optimize function, particularly mitochondrial function. And that's really going to be one of our key focuses of the webinar today. So if you are thinking, well, I just don't want to get the virus, lockdown measures are easing in various countries, there might be a greater risk of this Indian strain, etc. What we want is we want an appropriate immune response. So we want good Th1 response that will then be able to eradicate the pathogen, and then we will trigger resolution, so that T-regulatory anti-inflammatory phase, and we get resolution. If we have, unfortunately, excessive activation, we actually end up with more damage. So we get both epithelial and endothelial tissue damage. So that could be in the lungs, the respiratory tract, for example. And that's caused by an increase in damage-associated molecular damage and pathogen associated. So we're more prone to then picking up other infections. We get more inflammation, we get more neutrophils, macrophages coming in, more damage. We get this ongoing inflammatory link. And that is obviously incredibly damaging and also could be life-threatening, because what you're getting is that cytokine activation. So it's just worth remembering that it is natural that when we have an infection, we get some inflammatory response. That's a natural process because it's part of the immune system signaling to the key players to come and resolve it for us. So when we have an infection, what we're really getting is a number of inflammatory cytokines really signaling to neutrophils, and then they will activate and signal to macrophages, and they will then engulf, and then there will be resolution. So we're getting a number of inflammatory cytokines because, things like IL-1 beta and TNF alpha, they are the signals for the neutrophils to start doing their job. And certainly if you've ever done your blood cells, during an active inflammatory response, or an active infection rather, you'll probably see very high neutrophils and maybe high monocytes as well, because that will tell us that you're trying to fight something. And that has an inflammatory response. So we do have inflammation. We just want to be able to promote resolution as well. So the key point here is, when you first get an infection, you need your immune system to do its job. You need it to clear. So you don't necessarily at that point want to pump in too many anti-inflammatories at the beginning, because if you do, you may not get resolution, because what you're actually doing is promoting T regulatory cells and you're not getting an efficient Th1 response. Now, actually, there are a number of key nutrients that will do both. They will kill and they will help to resolve as well. And that's really what you want. But the point here is you also want to make sure you're doing everything now to keep your baseline inflammation low. So really start focusing on stress, sleep, diet, and anti-inflammatory is absolutely fine now. You just don't want to take them at the beginning of an infection. The longer you are in the state of trying to kill that pathogen, the more opportunity for damage to your tissues. If you start getting a lot of damage, you then activate your immune system to come to that infection, and then you get this cycle loop of extra inflammation. And here is a really good paper. It was published in 2020 about COVID, about coronavirus. And it was saying that in some individuals, the immune system does not clear the virus. Well, that's what we've just talked about. And what happens is you get viral replication and spread. So we're not clearing it. And then they're saying in other individuals, we have an overactive immune system, which may control the virus, but leads to damage, collateral damage to neighboring tissue. Both scenarios are not good, and they will lead to severe respiratory disease, organ failure, and death. May. So it's just worth mentioning that we want an efficient immune system to clear it, but we don't want an overactive inflammatory response. That's the key. So ask yourself, am I sleeping well? What's my diet like? Do I need to lose weight? Do I need to put weight on? What's my stress level like? Am I eating enough anti-inflammatory foods in my diet? And interestingly, in a couple of weeks' time, we're talking about anti-inflammatory diets. Are you eating something that's actually making your gut symptoms worse? Any ongoing inflammatory conditions you have worse? Are you eating a food that's promoting inflammation? Have you got a gut infection? Because a gut infection, by its definition, the same with, say, you're asthmatic, these are Th2-driven inflammatory conditions. And by default, if you're more into that Th2, then you're not going to have such an efficient Th1 antiviral, anti-infection response. So again, correct any gut problems. Make sure that any other health conditions you are managing well. Because what this graph is showing you is that if you've got the green graph, then actually your baseline, if your baseline information is at the green and you then get COVID, then you've got some room to move in that inflammatory status. But if your baseline of inflammation is higher, where that red graph is, then when you get COVID, you're going to be very close to an inflammatory overreaction. It's going to take you potentially to that threshold. So we need to make sure our baseline of inflammation is down. Now, I'm citing a few papers because, there are quite a few papers coming out on COVID specifically. And this is really talking about, again, the problem of inflammation and why we do need to really be thinking about what can we do to keep our inflammatory levels down. And one of the big drivers is something called NLRP3 inflammasome. This is well being noted. And what happens is the virus will activate this inflammasome response. And that leads to, lots of macrophages coming in, lots of damage and so on. Now, what's interesting is one of the ways that we can inhibit that activation of that inflammasome is making sure we have a potassium-rich diet. So in a way, this is going back to the old alkaline style of eating. When you have very low potassium in your cell and you have low pH, you will have greater inflammation. So let's think about lots of leafy greens in our diet, or just vegetables generally, and fruits, green smoothies, green juices. Think about your stress, because when you are very adrenally under stress, the potassium sodium ratio goes out, and that's crucially important. So really focus on, alkaline rich vegetables and fruits. So we need to keep our inflammation in check. And this is true whether you're suffering with long COVID or not. So more potassium in the diet. And then some of the key nutrients that also give you a double win. So a lot of these not only inhibit the inflammasome and promote something called SIRT2, which is very effective at restoration and lowering inflammation, but some of these can also help to shift you more into Th1 rather than Th2. And intermittent fasting has been shown to help lower inflammasome. So something like the fasting mimicking diet can actually be very useful. And then, of course, just be making sure there's nothing in your diet that is actually aggravating inflammation as well. So let's talk about, you've had the infection, you're in recovery, or you're trying to get over it. And this is one of the key things that has come out quite a lot. And that is that 20% of recovered patients, so they recovered, but they had fibrotic disease 9 months post-infection. And, this will likely to be developed on because, this is a new virus that's affecting people. The chances are this was April 2020. I suspect there'll be more papers coming out. And this was very much talking about the role of that inflammasome, which drives that fibrosis, and that's tissue damage. And what we don't want is lingering inflammatory response and fibrotic damage. That's tissue damage. And we know that can now linger many months after having the infection. The other thing to remember is that those that have had very severe COVID or been in hospital, they have a greater risk of developing antibodies to certain other tissues, particularly rheumatoid factor. And what they also showed is that more than 70% of patients who had a high inflammatory response, so they had C-reactive protein that was high, were much more likely to develop antibodies, particularly to joint tissue, rheumatoid factor, and so on. So again, another reason for really keeping the inflammatory response in check. So let's just have a look at some definitions, because NHS England and the Chief Medical Officer of the Scottish Government have now asked NICE and the Scottish equivalent to develop guidelines on the long-term effects of COVID. So it's widely recognised this is affecting thousands, probably millions of people. And so there is a guideline that is now being developed, and there is very much, developments in process, because it's uncertain yet what the long-term effects are. So there are guidelines being developed. It is now very recognised that long COVID exists and is affecting people. And there are a few definitions that have been developed by NICE. This was in 2020, December. Acute COVID, signs and symptoms of COVID-19 for up to 4 weeks. Ongoing symptomatic COVID is where you have signs and symptoms from 4 weeks to 12 weeks. And then post-COVID syndrome, or long COVID, which is what it's sometimes referred to, is where you're having symptoms which are consistent with COVID for more than 12 weeks. So That is the official definition at the moment. And the reason they sort of given this rationale is that, they recognize that signs and symptoms are likely to arise from any system in the body. They may well overlap, and you may well find that they change over time. It is likely to include any of these: cardiovascular, respiratory, gastrointestinal, neurological, musculoskeletal, metabolic, renal, dermatological, auto, hematological, and autonomic, basically everything. In addition to psychiatric problems, pain, fatigue, and fever. So pretty much every organ of your body could be affected. And you may find, if you are suffering from post-COVID, that, for a few weeks, certain areas of your body really hurt, and then it's another symptom that you get, and another symptom. You'll get overlapping symptoms, and they won't necessarily all occur at the same time. Just to remind you, long COVID is not contagious because the symptoms are caused by your body's response to the virus continuing beyond your initial illness. So if someone's suffering with long COVID, they can't give it to you. And the most common symptoms include fatigue, headaches, palpitations, chest pains, low blood pressure, so some association with POTS, for example, insomnia, anxiety, brain fog, joint pain, not being able to really cope with too much exercise. And here's some of the symptoms that have been highlighted. Persistent fatigue and breathlessness are particularly evident. And often, you may not, if your doctor does a C-reactive marker, which is sort of a generalized level of inflammation, only 9.5% actually had that raised. So just because your inflammatory markers are normal doesn't mean you aren't suffering with long COVID. Now, it's worth mentioning that the area of nutrition and COVID are still very much, in the early stages. And, some papers are actually quite dismissive of the role of vitamins and minerals, although, that's actually incorrect. There are now a number of studies that have been shown to really highlight key vitamins and minerals being either very useful for stopping you get the condition and or helping you recover from it, particularly things like vitamin D, zinc as well, and various other minerals which we'll go into. But vitamin D and zinc particularly have been shown to reduce not only the risk, but improving your symptoms if you've got long COVID. And one other in particular is vitamin C. There are a number of studies showing high doses, and we're really talking about high doses here, not just 1 gram, but high doses. Often these were intravenous in the studies. They're quite a high level, but very, very effective at helping people to recover from SARS. And, vitamin C plays a key role in NK killer cells, for example. So it's supporting that initial fighting effect, but it also is a potent antioxidant. So it's helping protect our cells from damage as well. So that makes a lot of sense, to be honest. There are a huge number of other trials still underway, 45 other vitamin C trials underway at the moment. It's obviously also been shown to help with recovery from COVID-induced sepsis. And there's other studies which have shown that, vitamin C, those that have a high intake have a much greater improvement and lower risk of mortality as well. So the trouble is that this is where supplementation is going to be likely, because, some of the studies are using 6 to 8 grams of vitamin C. Well, you're going to have to eat an awful lot of oranges in order to get that amount. So that's why, things like the liposomal vitamin C spread throughout the day could be actually very useful. Vitamin D, make sure you have got your vitamin D checked Keep it optimal, whether you're suffering with long COVID or you just don't want to get the infection. There are a number of ways that vitamin D helps our immune system. It helps, first of all, dampen the actual entry and replication of the virus. It reduces pro-inflammatory cytokines. It increases the anti-inflammatory cytokines. It enhances natural antimicrobial peptides. It helps the macrophages do their job. And it helps to promote resolution as well. So it's a double win, this one. It's going to help the infection, it's going to help the resolution. Now, the other area of research is now about why is there such an association with what's happening to people with long COVID and things like ME and chronic fatigue. And the common thread seems to be mitochondrial involvement. So long COVID, and there's now a national consortium on this to really look at the long-term effects. One of the areas that they're looking at is the consequence that the virus infection, it disrupts and destroys mitochondria. And mitochondrial function is one of the central areas that is looked at with chronic fatigue and ME. Still not fully understood, but certainly if there's things we can do to help mitochondrial function. And reminder, we talked about this in the fatigue webinar under menopause, so do go and have a look at that. Then this may help symptoms of long COVID. So mitochondrial intervention is going to be important long COVID. And now here's the other combination. Mast cell activation syndrome. It's called MCAS. Mast cells are activated by SARS, and only recently recognized is the condition called mast cell activation syndrome. And this is a chronic multi-system disorder where there are over-exaggeration of inflammation, allergic mast cell degranulation going on. You have this hyperinflammatory response, and this now seems to be very much linked with what's happening in long COVID and ongoing fatigue in long COVID. So it may well be that mast cells are playing a key role in the ongoing symptoms of long COVID. And this again is an area that is being really quite studied at the moment. So we know that with COVID infections, whether it's mild or moderate symptoms, there are likely to be fibrotic lung damage. That's one of the things that we know often happens. And again, it is likely that overactivated mast cells are contributing to that fibrotic damage as well. So we know that mast cells are already involved in some of the symptoms related to COVID infections, particularly around chronic respiratory and neurological symptoms as well. So we might want to be thinking about, well, what can we do to tackle mast cell activation? Well, the first thing is to look at histamine in your diet. So a low histamine diet could actually be very useful. You might also want to be looking at what drinks am I drinking that may be blocking histamine breakdown, which foods are actually eliciting a histamine release. So classics would be, certain teas will block histamine, green tea extracts and so on, probably not a good idea. And classic foods would be fermented foods, even if they're good for the gut. Kombucha, not a good move for histamine. Wine is not a good move. Beer is not a good move. Lots of pickled foods, not a good move. So there's a whole list of histamine foods. And if you are, eating a lot of those, and or you've got a lot of mast cell activation, that could just be really activating far too much inflammatory response and potentially fibrotic damage as well. There are a number of antihistamine drugs, that are being that are available. Your classic ones are just the over-the-counter Piriton type things as well that can be useful. But there are also a number of key vitamins and minerals that can also be very useful for tackling mast cell activation. Again, vitamin D comes into it, vitamin C, natural antihistamine. Niacin in particular has been shown to be useful, zinc, quercetin, selenium, magnesium. And then check your methylation pathway because that's very much involved in clearance of histamine in particular. And for some people, of course, they may have an enzyme variant in something like DAO, which is an enzyme that helps to clear histamine. So certainly looking at histamine and nutrients that can help to lower that may well be helpful for some people in long COVID. So we need a step-by-step approach depending on where we are at the moment, whether we're thinking about prevention, and this would be relevant to any virus infection. Have we got an infection? Have we got ongoing inflammation? How can we help ourselves recover? Now, I have put this slide into a downloadable PDF because this was produced by a number of doctors in a very, very good paper about a phased approach to tackling COVID, led by Dr. Yannick. And what they have done is they've listed the different stages of the infection recovery phase and the key nutrients that you might want to consider. So you can see on the left hand side, you can see that it will break them down into what their action is. So there's a general foundation support, which includes things like the vitamin D, the vitamin C, melatonin, quercetin, fish oil, high potassium diet. So that's your basics. That's what we should all be looking at. Good sleep. When you don't sleep, by the way, you will push your body into a Th2 response and you will affect your ability to kill the virus. You need to sleep. And obviously in the UK, melatonin is not available as a supplement. It is available on prescription, but certainly getting sufficient sleep is going to be really important. How do you know if you sleep well? Well, not only, obviously when you wake up, you might not feel refreshed, but one thing to ask yourself is, how often do you dream? If you're someone who's noticing that you're dreaming a lot more, that may not actually be a good thing for your Th1 response. And the reason I'm saying that is that that means that you're spending more of your sleep time in the REM cycle. And actually what you want is more slow wave sleep. Slow wave sleep is really what's restorative, will lower inflammation and support Th1. So that's often another thing just to ask yourself, how often am I dreaming? It's not the only way. I mean, if you know that you're tossing and turning all night, you know you're not sleeping. Then we've got some antioxidant support, and I'll talk about that in a minute. We've then got supporting our natural killer cells. So this is really useful during that prevention infection phase. Astragalus, andrographis, reishi mushrooms, really good at supporting NK killer cells. And then supporting your Th1 response, so again, to help tackle viruses, things like the berberine, skullcap, very good. And then at the bottom, you'll see anti-inflammatory. And you can see that these become more important in your recovery, lowering inflammation, long COVID. And that's where things like curcumin, bromelain are going to become more important. So it's not saying you need all these nutrients at all. It's saying look at where you are at and think about what is priority for me. It might be that it's the prevention phase. It might be that you're in that recovery. So the baseline is you just want to make sure, and this could just be a multi, that you have enough vitamin D, A, C, and E, and enough zinc. Those are baselines. You also want to make sure you're doing everything you can to keep your baseline inflammation down. If you are a higher risk person and you really don't want to get the virus, or you're worried about getting the virus, and high risk, I mean, you already have a respiratory disorder like asthma or something similar. You have chronic kidney disease, you're obese, you've got diabetes, you've got cardiovascular risk factors. Those are really the key risk factors. Then you may want to consider putting in some more things for NK killer cells or Th1. But these are your baseline support. And a lot of this could be just multi plus a really good diet. Now, if you've got an infection, there may be certain things you really want to start upping. And again, it could just be you up your vitamin C. I'm not saying you have to go out and get all these nutrients. But some of these on the right-hand side are more to do with stopping Th2 become too dominant and lowering histamine, so your quercetin, melatonin, niacin, vitamin C. So those are also going to be very useful for long COVID. And then supporting your NK killer cells and Th1 response on the left are many of the herbs like astragalus and agrafes. That's partly why I quite like Pro Greens, which is the allergy research powder, because it actually contains quite a lot of these. And also something called Holy Immune, which again by allergy research, again contains a lot of these. So that, those are powders that could actually do a lot of those nutrients in one go. Now, if inflammation is your concern, and remember, this is often driven by that inflammasome. So you want a really good alkaline plant-based diet, lots of potassium-rich foods, green juices, green smoothies, and so on. Curcumin. You may well have to take this as a supplement because absorption from food, if you're just chucking it in the old curry, probably not going to be enough. Bromelain, which is an enzyme, it's a proteolytic enzyme, comes from the core of pineapple. So when you're eating pineapple, please eat the core. That's the biggest area where you'll find the bromelain. You take this away from meals because it helps with things like the fibrotic damage and so on. So it's a very good one to take away from meals. And then sulforaphanes are found in all the leafy greens. Resveratrol is your berries. Melatonin, Perilla is in, it's a herb. It's very good for the gut as well. So it's in a product called GI Wellness by Allergy Research, and omega-3s as well. And then recovery. So we want to downregulate any chronic inflammation. So we're still looking at those anti-inflammatories, and we want to stop any fibrotic damage as well. And this is where glutathione is really important. This is why I've often said to people, if you're worried about having a severe reaction after your vaccine, the next day, glutathione is probably one of your best choices, because what that's going to do is help with that inflammatory response. And also, when you have an infection generally, you will be obviously asking neutrophils and macrophages to come in. Macrophages use up glutathione. So you always want to make sure you've got a good level of glutathione. And if you've done your own genetics and maybe you've got a variation, which means that you don't necessarily produce glutathione as well, then glutathione becomes more important. So I've mentioned here, some of the key products for immune support would be something like Holy Immune, the neonatal multigland or immunoglandplex. If you're really struggling with fatigue, then I would say look at the mitochondrial or the fatigue webinar I did. Things like PQQ, NADH, and I've given you an example of a product that's available from Natural Dispensary, CoQ10, resveratrol. And in some cases, adrenal support could actually be very useful for you as well. Glutathione is really an important antioxidant for your lungs. It's crucial for the lung epithelial cells when you have any inflammation, and damage, you will deplete your glutathione. It's a potent antioxidant. Your macrophages are using it up as well. If you have low glutathione, it leads to a worse lung disease response. It will also shift you. If you're very low, you'll be more in that Th2 and you'll have a lower Th1 response. So it really is important that you support your level of glutathione. And, there's a number of foods that can do this, and a number of supplements. You can take it as a supplement. Acetylglutathione is very much available as a supplement. It's just expensive. Whey protein powder, by the way, will actually support glutathione. But so will selenium, cordyceps, glutamine, alpha lipoic acid, NAC, and that's really cysteine-rich foods. So protein-rich foods, chicken, eggs, fish, oats, broccoli, those can also support it as well. So let's open up to questions, but a couple of things I just want to mention. If you're recovering from severe COVID, and you are someone with a family history of autoimmunity, be mindful that if you're not clearing that virus and it's lingering, that could potentially increase your risk of autoimmune antibodies. And in some cases, I've been doing the Cyrix ARI5 just to check on that. But it's worth just mentioning, long COVID will manifest in a wide array of symptoms. Everything from gut symptoms to cognitive, to neurological, to fatigue, to headaches, to anxiety, to poor exercise tolerance. Many of those symptoms overlap with mast cell activation, and therefore, in some cases, looking at reducing histamine and mast cell degranulation could actually be very useful. So that could include a low histamine diet, key supplements like quercetin and niacin, and also looking at key antioxidants, including glutathione, to help as well. So it's a lot that I've covered. It is an ongoing development, and I am pretty sure that I will be probably doing another one of these in 6 months' time, when there'll be new research coming up as well. So I'm going to open it up to questions. Now, I'm not going to put my camera on because last week when I did that, the whole system collapsed. So apologies for not being able to see me, but Chris is here. If you've got any questions, whether that's to do with yourself or a colleague, then please just type them in and Chris will read them out.
Great, fantastic. Just one question at the moment, or it's two questions, but I'll ask them at the same time because they're connected. It's from Daniela. Is there anything in the diet that stops absorption of potassium, or something in the diet that can improve the absorption of potassium?
Yeah, so that's a very good question. So generally speaking, most minerals are, absorbed initially in the stomach, but what we do know that is not necessarily affecting the absorption, but will increase the excretion, is if you are someone who's got gut inflammation. So that could be in the small intestine, like SIBO, or in the large intestine. So if you suspect you've got a gut infection, you might have low-grade inflammation in the gut, and you're getting diarrhea a lot, that will lead to an increase in the excretion of potassium. So, if you are someone who has a lot of loose stools, that would be an area to really be thinking about. And keeping yourself hydrated is going to be really important. Remember, of course, if you sweat a lot, when you're exercising or other times, you are going to excrete more potassium. So it's more to do with the excretion and whether you're getting sufficient for your body's needs than the actual absorption.
Great, fantastic. A few more questions coming through. Again from Daniela. Christine, would you consider working with someone who is looking to take the vaccine while under supervision to help with a possible autoimmune activation?
Sorry, can you read that again?
Yeah, sure. So would you consider working with someone who is looking to take the vaccine while under supervision to help with possible immune activation?
Yeah, so I mean, the key thing is, and this is what I would, first of all, if someone has an autoimmune condition or they've got concerns, it is worth speaking to your GP, because it may well be that you are offered one of the mRNA vaccines like Moderna or Pfizer instead. Very little evidence at the moment that one may be worse than the other in terms of the link with this autoimmunity that I've spoken about. But I certainly know of GPs that are, where there is some element of extra risk, you know, fibrotic or whatever, they might be offered something like the Pfizer or Moderna. So, you know, that's just a general side point. One thing I would say is your risk of getting COVID and then developing an autoimmunity is much worse than having the vaccine. You know, my opinion is that it is better for someone with an autoimmune condition to have the vaccine, because if you get the virus, that is much more severe in terms of your risk of then developing another autoimmune disease. The first thing I would say is, when you are going to have the vaccine, you want an efficient immune system prior to going to get your vaccine, whether it's the first or whether it's the second. So that is your baseline of vitamin D, C, and so on. At that point, I wouldn't necessarily be plugging in too much omega-3s, because you might put your body into that tolerogenic phase, whereas actually you just want to have the vaccine, calm any inflammatory response that you may get, and you know, resolve. This is not the same as having the virus. You know, the vaccine is not the virus, but you might get an inflammatory response, even if it's very temporary, when you have the vaccine. And then what I normally suggest to people is a day after, obviously, you know, rest, do not overdo it, but also you might want to consider something like glutathione, you know, just to support the body's natural antioxidant, anti-inflammatory processes. And then, you know, depending on whether they have an adverse reaction or not, it's very difficult to know. A lot of people don't have anything at all. They then may want to just put in a few anti-inflammatories. I'm not sure if that answers your question, but I hope it does.
Cool, thank you. Sorry, I'm just struggling to get the questions up. Oops, hold on. A few technical difficulties here. Now, if you can get the comments up, Christine, I think Facebook's just crashed on my monitor.
Okay.